I got it right here. So for those of you that haven't seen it, an FDA approved medication. It's called Methylene Blue. You can actually buy it online from Amazon without a prescription because it goes in chemistry sets. They use it in veterinary medicine. They use it topically on infections. It's actually great for antibiotic resistant infections. And what we're advocating is that you pour some in, you use it as a mouthwash, and then after it's been in the mouth for a period of time, you take a photodynamic device, which is already FDA approved for periodontal disease and for teeth whitening. And we worked with this company to change the wavelengths of light so that this light coming out of here would synergize with this chemical so we could drop the concentration of this into a very, very safe range. We could give this to young children quite safely. We could give it to the elderly quite safely, have them use it as a mouthwash, and then these two things together are what's been used to sterilize blood from HIV, from MERS, from SARS. It was used to sterilize the blood that was used in China and New York City and is now being used on the East Coast for patients on the ventilator. If I have to be put on a ventilator, then one of the things that my doctor should be asking my family or the other people within my social bubble is, could I have some of your blood? Could I have some of your blood? Could I have some of your blood? You guys aren't as sick as Dr. Tom. He's on the ventilator. So we want the antibodies out of your blood. We're going to combine them, and then we're going to shoot them into his vein, and that increases his chances of getting off the ventilator. It's called gamma globulin therapy. It's been used for a long time, and this is exactly the technology that's used to sterilize the blood so that my child that has hepatitis C, my daughter that has HIV, my wife that has mononucleosis and herpes, I don't get those additional viruses. I just get the antibodies.